Hello guys, it is Sunday and it is 7 p.m. already. Um, Today I start with week 6. I am currently taking MedSurg 3 and we just started with maternal and newborn. Actually for MedSurg 3, today we start with week 6 and maternal we just started last week. So this would be week 2. So today, besides studying um, for tomorrow's midterm, I am gonna work on a concept map for my clinical. It is actually due today, but I got some information on the clinical side. See, I got all my notes, so it's not gonna be. I should finish pretty fast. This is page 1. It's halfway completed. I basically need pathophysiology for the primary diagnoses and the NANDA. And this is what the second page looks like. And basically whatever I have on the first form will be transferred onto this one. So it's same information, just in a different format pretty much. We are in week 7. Week 7 because we have a midterm tomorrow. So yes, week 7. I've been so stressed out. I have a lot to study. I have assignments due. We just finished actually a 14-page assignment that we had for maternal and newborn. It was called a learning activity, 14 pages long. That took a long time to do. So yeah, I'm gonna finish up on the concept map. And then for this week, let me give you a little recap of what's due tomorrow and Wednesday. So tomorrow for MedSurg 3, I have to do, which I will be completing today because tomorrow I work all day and then I have class right after that. So ticket to class, reflection activity, and we have to watch a recorded lecture before we go to class. I might watch it during my lunch break when I'm at work. And then our midterm is 100 questions and it is worth 200 points. Then for maternal and newborn, there is a video we have to watch. And then we have, all this is due Wednesday. Then we have a NGN case study number 1. This is my first one for this class. So I haven't looked at it. I don't know what it's going to be about. And we also have a ticket to class. This week on Wednesdays, we don't have the discussion post for any of those 2 classes. And then on Saturday, I have my clinical, start at 6:30 and it's 12 hours long. And then Sunday for the clinical, I have a clinical reflection due, which is the 4th one. And then I have a little note here for MedSurg 3. We're going to go over the neurologic system, which is related to the nervous system. And we're going to be going over functions of the brain, the cranial nerves, and other topics related to that. So I have a lot of reading to do. I remember taking anatomy, and those cranial nerves were really difficult to memorize. And then for maternal and newborn, we are on chapter 4, and it's about prenatal and adaptations to pregnancy. So with this one, we will be going over prenatal care, signs of pregnancy, nutritional needs. So yeah, it's a lot. I've been really stressed out, and I even wanted to call off work tomorrow, but I think I can do it. I've been studying for the midterm today and yesterday, so I should be okay. Then after I finish these assignments, I will go back and study for the midterm. Hello guys, today is Monday. Right now it is around 4:15, 4:30. I'll be taking the midterm today. Class starts at 6. I am so nervous. This midterm will consist of the endocrine system, the ear, and the eye. I did well on the first 3 quizzes, which were all on the endocrine system. We did not get quizzed on the ear and the eye, but it will be included here in the midterm, so I hope I do well. And I was supposed to get off at 5:30 from work, but I decided to leave a little earlier just so that I can review more, because this midterm is 100 questions and it's worth 200 points. So I need to do well, or else it's gonna drop my grade a lot. Right now I have a 95 point something % overall in the class. So this exam will determine, actually quiz 2 and 3 haven't been graded. Only quiz 1. Earlier I stopped by for an iced coffee, and I actually have it in here, just because we cannot have open cups or cups with a straw. They have to be completely closed to have them in the classroom. And I also have my water bottle, which I finished when I was studying at the park. I think I can refill it here anyway. So I'll be sitting in my car for a while until it's time to go in, and I'll just be reviewing for the midterm. I'm so tired, I'm sleepy, I'm hungry, I'm everything, but I want to wait until I take this exam to get something to eat, maybe during my break. I will let you guys know later how I did in the midterm. Starting to feel really warm in here. I might just go inside the building and study in there. I'll see in 5 minutes. It is now 5:50. I decided to stay in my car. It's time to go inside. This exam is about a minute per question that I know of. We're not going to have any NGN questions. I hope we don't, but if we do, I'll let you know later. It is Wednesday today. It is 5:30 p.m. right now. I'm already at the school. Class is about to start in about 30 minutes. So today is our second week for maternal and newborn. Last week our professor didn't come and we almost got sent home. Luckily they found a sub last minute and we got to stay. The professor lectured. If we get sent home, we have to come back another day to make up for those hours. So we're so happy that the school found a sub for us last minute. Well, on Monday I took the midterm for surg 3, and I'm so happy. I got an 87%. Anything above 75 I'm happy with. So I'm doing good in the class. I think I still have a 95.15% overall so far. The midterm hasn't been graded, so we'll see how much my grade drops after that. So today is another classmate's birthday, and I got a little gift here for her. bag is so cute. I hope she likes it. I feel that we've been celebrating birthdays, a lot of birthdays since last month. It's always fun. We're gonna have some cake again. I have my favorite energy drink here. It's a V8 strawberry and kiwi flavor. It's so good. It's refreshing also. So I think I'm gonna go inside the class because I still have to download the PowerPoint and go find the classroom. I don't know which classroom we're gonna have today. Then yesterday I worked, and then when I got home, which was around 6 p.m., I was working on the homework for this class, which was the NGN learning activity. That took a little while. It does take some research. And I also did a ticket to class. This ticket to class is a little different than our previous classes. I'll talk about it a little later. I have to go inside the building. Hello guys, it's Thursday. It is 2 p.m. now, and today is a beautiful sunny day here in California, which I'm happy about because it's been cold lately, and usually on weekends it's been raining. It's been a little rain, but it feels like winter still. I'll be going out today, which I'm happy about because I have to go to work, but it's okay as long as I get to go outside on this beautiful day. Even if it's to go to work, I'm happy about it. So I'm just going over my planner, and it looks like I already finished all my assignments for this week, or almost all of them. So for this side, nothing is highlighted because it's just that I have to go to the clinical rotation on Saturday, and then I have to do the clinical reflection. It's due by Sunday, but I cannot work on that until after Saturday, after the clinical, because it is related to that. So for med surg, I did ticket to class, reflection activity. I took the midterm, and today earlier I watched the recorded lecture, and that's it for that class. Then for newborn and maternity, we had a NGN case study, which was a 14-page assignment, pretty long. And then I also did a ticket to class. Then for that, I wanted to do some flashcards on chapter 2, I believe, 2 or 3. Then I remembered I have my flashcards from Level Up RN. So I don't have to spend time on doing those flashcards. I'm just gonna pull this out and study from the. I think they have a newer version of these, but let me show you. It's still pretty good information. I don't know exactly what's the difference, but this has the information I need to study for my quiz. For med surg, we have 2 quizzes left. I believe it's 2 or 3. I'm pretty sure it's 2. Then we have the proctored exam and the final, and that's it. Then for newborn and for maternity and newborn, I believe it's only 3 quizzes. We also have a proctored exam for that one and the final. We're going to have our first quiz in 2 weeks. So I already have to working on a study guide for that. And I also found this book, the ATI. The only thing I don't like about this is that it's a really good source to study from, but it's not, the chapters are not the same as the chapters we use on the textbook. So we just have to look for the information. That's what it looks like. So I'll be using this as well to study It's more concise. So I like that. So right now, what I'm gonna do is I'm actually gonna write on my planner what's due for next week. And like that, I think I'm gonna have some downtime at work today, maybe a lot of downtime, and that means I can study. I'll let you guys know how it went. Talk to you later. Hello guys, I'm already at work. It's a little early and I brought my iPad and my little bag with some things. So there's a little park around here. I might walk around since I have gained some weight since I started this nursing program. And I'm gonna try to go on a walk more often. We'll see how that works out. Maybe I can do that little hike. And there's nobody